Now I will request Kishore Kumar sir, Professor and Head, Department of Integrative Medicine, NIMHANS, Bangalore.
Thank you, Dr. Madhumati. At the outset, I would like to thank uh, Dr. Srikanta ji and Madhumati ji, both of them, for having facilitated this presentation of mine in this August platform. I would also like to acknowledge presence of my mentors from CCRAS, Dr. Srikant, Dr. Bhushan Patavardhan, Dr. Kaustuba, Dr. Sulochana, and the team. Before I came to NIMHANS, I worked in CCRAS for 10 years before I took up the assignment on mental health at NIMHANS. I would like to quickly share my experiences than present uh, is what has been my perspective. So this is the NIMHANS has had the history of integrative medicine since 1954. It was post-independence, and mostly the Ministry of Health and Family Welfare, which incorporated the Ayush sector also, which was taking care of the integrative or Ayurveda and its practice at NIMHANS. And later it evolved into many forms where the Ayurveda Research Unit was formed and then it was conducting research. So it has been there at NIMHANS since a long time. Apart from that, the other form of Ministry of Ayush and CCRAs has been collaborating with many of the departments. The Department of Neurophysiology was among the few departments which took up the research in yoga to start with, and then other departments like Department of Psychiatry. Then Dr. D. Nagaraj and Dr. B. N. Gangadhar, the two former directors. Dr. B. N. Gangadhar is currently the National Medical Commission chairman. Both of them played a very important role in establishing the Department of Integrative Medicine at NIMHANS in 2019. The unique feature of the integrative medicine model that we are following, which currently is known as the NIMHANS model of integrative medicine, is the physicians from the disciplines of Ayurveda, from psychiatry, and from yoga, we consult the patient at the same time. This is going to solve many problems of the patient. Should I take this medicine if I'm taking this with the conventional, with the allopathic medicine? How many days should I take? If something happens, whom should I report to? Is it going to be safe? How long should I take? Etc. etc. There's so many things. So when the patient has to go from room to room, so the integration happens at the level, systemic integration at the level of the consultants. So this we call as the systemic integration rather than the cafeteria approach, which is currently prevalent everywhere, wherein the patient has his choice to select what he wants and go there. Now, we are following the principle based on the fact that the treatment gaps have to be fulfilled. Not a single system of medicine cannot address the whole gamut of or the spectrum of symptoms, especially in mental health with the patient, which the patient presents, and there are so many gaps that can be fulfilled. I'll state you an example. If there is a patient, which I generally quote in many of my conversations, if there is a patient who comes to me with depression, mild to moderate, initially we start him off with yoga. And then later, maybe let's say he goes and comes back, and if there is a aggravation, then we add some Ayurveda medicines. And if there is an aggravation, again we add antidepressants or antipsychotics, and then after, withdraw the Ayurveda and yoga, because at that kind of a situation, the patient is not able to do this. And then after the patient stabilizes, we come back, he comes back, and then antipsychotics are withdrawn, yoga and Ayurveda are started again. So this is something which is happening with us. And one thing that we have noticed is the patient comes back and says, now I am not on medicines, this is what I wanted. I am disciplined, I get up early in the morning, I follow a very healthy lifestyle, I do exercise, I do yoga. It's a kind of a motivating factor, and it contributes to the loop of healing. So this is what we have noticed, especially in the depression, and this is the model that we are following at NIMHANS. I would like to just quote my experiences with some data. These are some of the patients. Every patient who comes to our OPD, we do the assessment just like a research study. So this is the data of around 90 to 100 patients who have come to us for follow-up after consulting us in schizophrenia. We have been able to do BPRS, SANS, and SAPs in schizophrenia with very good improvement. This is on Ayurveda and yoga. With integrative management, we mean Ayurveda and yoga. What is important is over a period of time, recently we have realized that patients with negative symptoms are responding excellently well. Positive symptoms, yes, we are doing, but then especially with Vamana, Virechana, and yoga, we are seeing patients responding extremely well. We have been able to document, and currently we have applied for a project to the CCRS, which is being considered for funding, and this might be a contribution that can come. We just finished an MD study on this. We had three groups: a Vamana group, a Virechana group, and a treatment and as usual group. We saw that negative symptoms improved significantly with the reduction in CRP levels also. This is anxiety disorders. I don't have much to say. Anxiety disorders naturally respond. And in depression, we just finished an MD thesis which worked on treatment resistant depression, and in whom we had given Virechana as a therapy. And after 15 days, there has been considerable improvement in many of the parameters, including the heart rate variability. This is the data of our OPD patients, maybe around 190 to 100 patients who have seen very good improvement. So, some of the studies which we conducted at NIMHANS, this was funded by the CCRAS, where we took the Medhya Rasayanas and looked at heart rate variability. We saw that patients of depression, not only the depression symptoms came down, but then their heart rate variability also improved towards the balance or the parasympathetic side. This was another study which was done at NIMHANS. Dr. Suhas Shetty also made a reference of this study, which was done by my colleague at NIMHANS, where we found out that it was very useful with, of course, neurophysiological parameters. Both these studies were conducted in Department of Neurophysiology. It was not only that it improved on the symptoms, it improved also the heart rate variability, and then also it modulated the sleep architecture in a positive way. This was some of the studies which was undertaken, started by the CCRAs at NIMHANS, basically the Brahmyadi Yoga, which currently is a very potential drug for the treatment of schizophrenia. This was personally appreciated by Dr. Gauri Devi, the former director of NIMHANS. There have been many studies undertaken by CCRS on this at NIMHANS on Brahmyadi Yoga. This was some studies which we have done on. This is something which we have done on cerebellar ataxias with very good improvement. And this one is on ischemic stroke. We saw that apart from motor recovery, the motor recovery was faster when compared to the treatment as usual with physiotherapy. But then along with that, we saw that there is a favorable modulation of cardiac autonomic balance. This was another study in Guillain-Barré syndrome. We have been getting many reports of Guillain-Barré syndrome now, and this was in neurological rehabilitation after the attack of GBS. And then in the postural stability of the spinocerebellar ataxia, too, we get a lot of cases at NIMHANS, and then we have been able to get this opportunity. And this was updates in Parkinson's disease, the evidence, and also evidence-based review of therapies. We have seen yoga and Ayurveda being mentioned as important. Now, this is one slide which is completely the study has been done by NIMHANS. Now, what you see on the top are the experimental models of amyloid. This is still under review for publication. Amyloid induced, and immunohistochemistry was done. This is Brahmi Bacopa, treated with Bacopa, where you can see the amyloid being gone, and then they treated with Manduka Parni. This is after 7 days, and this one is after 14 days. This is after 14 days, and 7 days we have seen that in the experimental models, in rat models, we have seen the amyloid being completely eliminated by Brahmi and Mandukaparni. Brahmi and Mandukaparni are the most studied drugs in such conditions currently. Now we have finished. We have this article has been accepted. Now this is a 6 case report of patients with negative symptoms who have responded excellently well with Ayurveda and yoga therapies. This is another ambitious research study funded by Ministry of Ayush. Here we have taken, the aim of this study is to provide comprehensive evidence neurobiological correlates to neuropsychiatric disorders. In terms of four, we have taken two: schizophrenia and Alzheimer's dementia, schizophrenia and mood disorders in terms of psychiatry, Alzheimer's dementia and multiple sclerosis in terms of neurology. The four pillars of investigations that we have undertaken are genomics, neuroimaging, gut microbiome, and immune. The study goals are to look at mechanistic aspects of how the Ayurveda based therapies, or Ayurveda and yoga based therapies, integrative therapies, how they act. It's like, there is a cohort of normal controls, there's a cohort of first degree relatives, and there is a cohort of the patients. So they will be classified based on their prakriti, and we will try to fix neurobiological correlates of these concepts as to how they are in patients, what is happening in first degree relatives, and how it is different from the normal controls, to say, or at least to provide evidence for predictability or vulnerability. This will be done. And it also has a component of clinical trials where all the patients of all these diseases will be given treatment, and to see if there is any change in those neurobiological correlates with the clinical Ayurveda correlates. So this is the project that has begun, and it is it is going well. The clinical trial phase is yet to begin. So this, Ayurveda, yoga, and biomedicine, integrative medicine in neuropsychiatry is what we are looking at. The pharmacological agents. Now, what we are looking at is how this integration is possible. There is no competition in the mechanistics. If you have a biological basis to a particular disease, and if your treatment is also having a biological basis, then it is working in those pathways. I still remember a conversation which I had with Dr. Rajesh Kotecha ji, the Secretary of Ayush, who asked me, can you tell, even Dr. Hemant Bhargav, my colleague, is here, he'll be talking of yoga next after my presentation, as to how this might be acting. Now, what we are seeing is you give yoga and give a treatment, the response to the treatment is much better. You give yoga and the patient is on treatment, the side effects are less. There is some kind of holistic action which is operating through the nervous system, is what we are hypothesizing. The same might be happening with the Ayurveda pharmacological agents also, is what we said. Then looks like a very good hypothesis. Let's say you treat the patient with Brahmi, and then let's say give him TMS, the response, the transcranial magnetic stimulation or repetitive transcranial magnetic stimulation, the response might be much better. You give him something, or they might be acting as modulators, we don't know, and then that's how the holistic action might be happening. So they are complementing each other, and that's why integration is possible. Because that is one question which people ask: I have some problem, you give me risperidone, you give me Brahmi, you give me Mandukaparni, you give me so many things. Are they not acting to create problems to me? No, they are acting at different other levels. This is what this is how the possibility of integration in terms of mechanistics is possible. And another thing that we have seen is the the utility of Ayurveda. Let's say a patient, I still remember a patient which was referred to us, was treatment resistant schizophrenia, and then was on clozapine, and then we saw that the patient's serum levels were high. But then we didn't plan to do anything. But then when we had finished giving him Vamana and Virechana, we saw that the serum clozapine levels had come down significantly, so that we could continue antipsychotic therapies. Then you have treatment emergent complications, menstruations, women resuming menstruations, weight gain being stopped. Then our psychiatrist colleagues at the hospital were saying, now we have referrals. Please do contact IMD, Integrative Medicine Department, for constipation. That used to be there, or for treatment emergent complications. So that's how we are getting the referrals. Now we are in a stage where we might get referrals negative symptom dominant to IMD. We are expecting that to happen. So these are some of my experiences with but these are general aspects, experiences with integrative medicine. Rest of the things, I think Dr. Hemant will continue from where I stopped in terms of yoga. Thank you very much.